A quick heads up, this episode deals with some heavy topics around mental health, accessing help, and suicide rates in First Nations communities. Hi, how are you?
Hi, I'm good, thanks. Nice to meet you.
Nice to meet you. Thank you so much for taking the time to speak with me today. Hello, my name's Billi.
Hi, Billi. There seems to be, is there an echo at your end as well or not?
From the Daily Aus, I'm Billi FitzSimons, and this is Young, Dumb and Informed. This is the podcast where we give you the starter pack for some of the biggest issues facing young people. Now, before we delve into today's topic, last week I mentioned that there is a federal election in the next 6 months, and we got a few comments from you guys saying you had no idea there was an election coming up. So let's take a leaf out of Margot Robbie's book and jump into the bubble bath. I'm going to explain when the next federal election is in under 60 seconds. So there's actually 2 elections that Australia is due for. One is for the House of Representatives and one is for the Senate. The Prime Minister is part of the House of Representatives and all members are elected for a 3-year term, with the current term expiring next year. Senators, on the other hand, are elected for 6-year terms, and the dates are staggered so that half the Senate expires every 3 years at the same time as the House of Representatives. So half of the current Senate will also finish their terms next year. And usually the Senate and the House hold their elections together just to make it simpler for voters. Now, Australia isn't like the US where there is a set date every 4 years. The Constitution says the Prime Minister can decide the date within a certain period. So we don't actually know when it will be. All we know is that for a number of factors, the last possible date for an election with both houses is the 21st of May next year. Until then, it's simply a guessing game. Prime Minister Scott Morrison could literally announce it tomorrow. We just don't know. But whenever it is, we want you to be informed. On today's episode, we're talking about access to mental health services.
It has been a very difficult time. Australians are hurting right here and right now.
It's okay not to be okay. Unprecedented times, anybody can feel the stress of mental health.
We have stopped. We have connected. We've been at home. We are in communication with people. We don't know the answer.
Tonight, we extend our support with a $2.3 billion commitment to mental health and suicide prevention.
Today we're looking at what the government is doing to help Australians who need access to mental health services. We know that demand for mental health helplines is at a record high right now. In June this year, there was nearly a 20% increase in calls to Lifeline compared to the same period in 2019. The question I want to know is, can young people get the help they need when they need it? And if not, what is the government doing about it? We put up a poll on our Instagram asking our audience if they've found it easy to access mental health services. 64% said no, which is particularly concerning considering the age group of people with the highest proportion of mental health conditions is young people. It's those aged 15 to 24. So I wanted to speak more to someone who had lived experience with this. I reached out to someone from our audience. Her name is Kate, and earlier this year she was really struggling.
So my name's Kate. I'm 25 from Brisbane. I'm currently studying my Masters of Psychology. So this year, things just got a bit overwhelming with uni and life, as they do. And I sort of tried to, work through my own strategies and things that I had known to help take care of myself. But I came to realise that I did need some extra support.
I also spoke to David Coleman, the Assistant Minister to the Prime Minister for Mental Health and Suicide Prevention. He's a Liberal, so he's part of the party that is currently in power.
So I'm the Assistant Minister to the Prime Minister for Mental Health and Suicide Prevention. Been in the role since December last year, and my job is to work right across government on issues that affect mental health and on doing everything we can to reduce the rate of suicide in Australia towards zero.
And the third person I spoke to is the Shadow Assistant Minister for Mental Health, Emma McBride. She's from the Labor Party, so she's currently in opposition.
So I'm the member for Dobell on the Central Coast of New South Wales. I grew up in Wyong and I went to the local high school in Tuggerah, and I spent most of my working life as a pharmacist and much of that time as a specialist mental health pharmacist. So for me, I was first elected in 2016, and then after the 2019 election, was given responsibility for our side for mental health and for carers. And that's, for me, been a real chance to draw on my background and training as a specialist mental health pharmacist and to bring it to this role and to help to raise some of the prominence and profile of these issues within the Parliament, to hold the government to account, but also to offer a constructive and positive alternative.
So there's 3 different people here who are all coming from 3 different perspectives about the same issue. Now, if you've listened to last week's episode on climate action, I do want to say that this episode will be really different. Mental health policy doesn't have the same polarising political perspectives that climate change attracts, and you definitely won't hear anyone questioning the existence of the issue in this episode. Mental health is dealt with in a much more bipartisan way, which essentially means it sees the cooperation of 2 political parties that usually oppose each other's policies. So by that I mean the Labor and Liberal parties for the most part agree on mental health policy, more so than they do on other issues. But that doesn't take away from the fact there are really significant issues facing the mental health system, and it's so important to understand what either party will continue to do if they win the next election. For Kate, like so many young Australians who answered our poll, deciding to see a psychologist was the first step in a really long process. She had to wait 2 months before she could actually sit inside a psychologist's office.
I realised that I needed the help of a psychologist. Obviously with what I study, I could recognise when I did need that support and I wasn't coping. When I did then go forward and try and access those services, for starters, I don't have a regular GP, and I think that's probably a common thing for a lot of young people, especially who have to move away from their hometown for uni like I did.
This is a really interesting point, that having a regular GP is a big advantage to entering the mental health system. According to the Royal Australian College of General Practitioners, young people are much less likely to see a regular GP and usually only go to their GP for more sporadic health issues, not for regular check-ins or ongoing well-being.
So I then had to find a GP to then get a mental health care plan, and that was the option that I chose because as a uni student, I am working part-time as well, but there's no way that I could afford to pay the full cost to see a psychologist. So I did access a mental health care plan through a GP who didn't really know me because I don't have a regular GP. So that was a daunting experience, I guess, in itself.
So Kate is talking about the mental health treatment plan, which is available for any Australian who has been diagnosed by a doctor as having a mental health condition. So right now, the way to get a mental health treatment plan is to book an appointment with a GP, who will probably get you to fill out a questionnaire about how you've been feeling, and then they will refer you to a specialist, such as a psychologist. You can claim up to 20 psychologist appointments per calendar year on Medicare, which is Australia's publicly funded healthcare insurance scheme. So for those 20 sessions, you'll pay less because Medicare will cover part of the bill. In some cases, it will even be free. And it used to be 10, but the government upped it last year during the pandemic.
And then it was a 2-month wait, I think, which is really not that bad. I have seen wait lists that are like 6 months at the moment. But that's, 2 months of making an appointment and waiting, and then you're not even sure if that psychologist is going to be a good fit for you or not.
And so what was that 2-month wait like?
It was tough, for sure. I mean, it had already been maybe 6 months of really struggling before then sort of going through that process of making an appointment with the GP and then trying to ring around and organise that appointment. So it was a long time, and I mean, it is a really tough period of just continuing on like as I was. But yeah, at least there was a little bit of hope that it was set and there was a date that I could sort of look forward to of when I was starting to get some help.
Kate isn't alone. Australia has a huge issue with supply and demand when it comes to mental health services. There are nearly 30,000 psychologists in Australia. But there are about 5 million Australians who suffer from having a mental health condition in any given year. And that data is from 2018, and we know that given the past year, mental ill health in Australians has only increased. And it's resulting in really long wait times. Here's what Emma McBride, and remember she's the Shadow Assistant Minister for Mental Health and is in opposition, said about the issue of wait times in Australia.
So we know that there is a shortage of health workers, particularly outside big cities. So if you might wait, several weeks to see your GP. Then after that, there might be a weeks to months wait, whether it's for a referral to Headspace or to a psychologist. There's also very busy and overstretched emergency departments where some young people might end up if they can't get into their GP or if they're not able to see their psychologist, when they need to. So I think some of the biggest barriers there's definitely a workforce issue, and that's across Australia, but it's seen more outside of big cities. So once you get to the Central Coast, just an hour and a half outside of Sydney, you'll see there's much longer wait times.
When I talked to David Coleman about this, and remember he's the person Prime Minister Scott Morrison has specifically put in charge to shape mental health policy, he talked about all the funding the government has put into mental health services like Headspace. So Headspace is the National Youth Mental Health Foundation, which provides mental health services to people aged between 12 and 25 years old. They do a whole bunch of stuff, but one really important thing they do is provide young people with access to professionals, either in person or over the phone or a whole bunch of other communication channels. They have more than 100 centres across Australia, and most of their services are either free or have a really low cost.
Yeah, so quite a lot of activities in that area. So in the budget, for instance, we put another $280 million into Headspace. So as you know, Headspace is focused on helping young people dealing with mental health issues. And then back in 2018-19, we put another $150 million extra into Headspace to help address these issues and increase the number of psychologists available, the number of sites, and so on. So it's about an extra $400 million over the last few years. We also, through the Medicare system, have expanded the number of consultations that people can have with psychologists under a mental health plan from 10 to 20 and potentially up to 40 for eating disorders. And then another thing which is very significant that happened last year was, as part of our response to COVID and mental health issues, for the first time we made telehealth, so video consultations, available via Medicare. And that's been really important because whether people are geographically isolated or whether they're perhaps in a town that doesn't have as many mental health professionals on the ground, that's been really important in expanding the scope of consultations, and so much so that telehealth now accounts for about 30% of all mental health consultations.
But the truth is, even with this, people are still waiting a long time to see a psychologist. So what more can be done to bring down those wait times?
Well, we're certainly, as I say, investing record amounts of money in this area. So $2.3 billion in the budget, which was the largest investment by the Commonwealth in mental health in our history. And so a couple of those things that I mentioned will directly address this issue. So $280 million extra for Headspace, so that means more clinicians, more locations, more services.
And that hasn't been implemented yet?
It's in the process of being implemented.
So we haven't seen the effects of that yet, is that what you're saying?
What we've done immediately in recent months is open up a number of what we call pop-up mental health clinics offering free services. So, for instance, in Sydney, just a couple of months ago, we opened up 10 new mental health clinics under the Head to Health program, and those offer free consultations for people.
But wait times aren't the only issue here. There's another crucial, sometimes crippling barrier that so many young people face once they do secure a psychologist session, and that's the cost. Even under the mental health treatment plan, which is designed to make mental health services more affordable, so many people are still finding it too expensive. And that's the issue Kate faced.
Yeah, I think on the outset I had to pay $200, but then you get something back from Medicare. But I think out of pocket it was still like $80 every time I went to the doctor. Which, like, if I was working, Like, okay, that is that investment in my mental health, and I would have been happy to pay that. But I've had a lot of issues with Centrelink, and it's like this balance between I could only receive financial help if I was studying full-time, but the degree is so full on that for me to study full-time, I am so completely overwhelmed and cannot function. Yeah, so it's like this trade-off of I don't have the money to pay for that service.
The cost is a well-known issue. Emma McBride also says the cost is often just way too much.
The other part, Billi, also is the cost. And for young people, that can be prohibitive. They might be able to be bulk billed, or they may be able to get a mental health plan through Better Access. But for many people I've spoken to and families I've heard from, they're having to pay a lot out of pocket and upfront for essential mental health care, which for young people who might be in secure work or part-time or casual work, that can be a real barrier to being able to access services.
So I put this important question to the Assistant Minister. Another issue that we hear a lot about is cost. I know you mentioned before that they've increased the number of appointments that you can claim from 10 to 20, but that ends halfway through next year. And also people are still obviously out of pocket after that, because that doesn't mean that the appointments are free. What is the Morrison government doing to bring down the cost of psychology sessions?
A couple of points on that. So there's a review of the Medicare system, which we call Better Access at the moment, and that will report back next year. And that will address issues, including the one you've raised about the number of sessions and so on. Headspace, as you know, is effectively free to patients. And Head to Health, which is this very big initiative in the budget, $500 million, again, those services are free to people who go and see them. And the new clinics that we've opened up in both Sydney and Melbourne in response to lockdown, they're also free. So there is a lot that's happening in this area, and we'll continue to move forward on these issues, because it's great that people are coming forward more. The truth is that COVID and all of the issues associated with lockdown have contributed to increased levels of distress, increased mental health issues, particularly amongst young people.
So that's the current government's plan. But like I said, there's a federal election coming up. So it's an important time to understand what the alternative plan is. So I asked Emma McBride, what policy does Labor have that directly targets young people?
I'm working with my boss, Mark Butler, at the moment. And one of the things that I've said to Mark is that we really need to make sure that we have a strong emphasis on children and young people. We know that most mental health problems now emerge before someone is 14, and most of them by the time someone is 25. So we have to make sure, if we're fundamentally going to improve the mental health and wellbeing of Australians, we have to make sure that we do it early in life so that people can live healthier lives.
Emma McBride went on to say a big part of the Labor government's philosophy would focus on cross-portfolio work, which I should say is not an entirely different approach to what the current government is doing. And just a note from me, cross-portfolio means working across the different government departments such as employment, housing, and social services. So basically, they'll look at what exactly is causing young people to experience these mental health conditions.
Because really, Billi, if we're going to be working on this, we look at what kind of the cause of the cause. And it's often the underlying circumstances of someone's life. If a young person hasn't been able to get, a good education or finish their schooling, if they're not able to get a foothold in employment, if they can't live in secure housing, all of these social determinants are what have the most significant impact on someone's mental health and well-being. We know as soon as your job is at risk, your mental health is at risk. So in terms of an approach from Labor, it would definitely be cross-portfolio work, where we would need to work across education, employment, housing, health, to make sure that all of those circumstances of someone's lives, that they're given, the best chance to be able to have a quality education, get a good job, live in a secure and safe place close to where they work, in order to be able to live, a healthy life.
Now let's turn our attention to what the government is doing to help the mental health of First Nations people in particular. Suicide rates are more than twice as high in young Indigenous Australians compared to non-Indigenous Australians. So I wanted to know, what policies does the government have that are specifically targeted to the needs of First Nations people? Here's what David Coleman said. So young people care a lot about the intersection of mental health and more vulnerable communities. What's being done to address mental health outcomes in First Nations communities? And is it a priority of the Morrison government?
Yeah, 100%. It absolutely is. So our budget package in mental health has 5 key pillars, and one of them is vulnerable groups. And within vulnerable groups, there's more than $70 million allocated specifically for Indigenous programs. There have been a number of trials of suicide prevention programs in Indigenous communities in recent years, and there's significant investment to expand those programs. There's significant investment to provide more mental health services in Indigenous communities.
Coleman went on explaining the government is committed to their initiatives and are focused on the complexity of the issue, but he couldn't exactly say if what they are currently doing is working. And just quickly on that investment that you talked about, are there tangible results that indicate that where you're putting this investment and where you're directing it is working?
Yeah, well, we always look at results of previous activity. So in recent years, we've run a number of suicide prevention trials, some in Indigenous communities, some in the broader community. And we learn from those. We learn what works, what doesn't work as well, and we seek to do more of what works. It's important to note with mental health that evaluation is complex because mental health is very multifaceted. And so in evaluation, you have to take into account a whole range of factors. You know, it's not always A plus B equals C.
And you're comfortable that it is working as effectively as it can?
Well, I think there's always more we can do. I mean, the mental health system in Australia, I think if you look back 20 years ago, the truth is that as a country, we didn't talk about mental health issues enough. And part of the consequence of that was that it could have got more attention historically. I think as a country, we've come a long way since then. And I think that there's really broad agreement, whether it's at the Commonwealth level, the state governments, community organisations, that it's a hugely important area.
Okay, let's return to Kate's story. Kate went to 5 psychology sessions in total, and overall, her experience wasn't that helpful. After accessing those 5 appointments, did you feel like your mental health was better off?
That is a tough question. Honestly, no. If I'm being completely honest, I think what did actually help me was the GP that I went to suggested antidepressants, and I have been taking those since then. But as a, psychology student, I don't want to have that position where I'm just advocating for medicating over, counselling services, things like that. Like, that's not the position that I want to take. But because the wait lists are so long everywhere, you don't really have that option anymore of trying different psychologists and figuring out which one is the best fit for you. Because, each time that you make an appointment with someone else, it's another 2 months or another 6 months until they do have an appointment open. So I guess I probably didn't get as much out of that service as I was hoping I could have. And I ended up, just stopped going after about 5 appointments, which probably, wasn't the best decision, but I just felt like they weren't the right fit for me. And by that stage, financially, I couldn't afford, to keep going anyway. So I just stopped, which is disappointing.
And so if it was affordable and there weren't those wait times, would you like to see a psychologist right now?
Yeah, absolutely. Yeah, I'm just not in a position anymore to be able to afford it. Like, plain as day, I just can't afford it at the moment. Even with the mental health care plan, it's just not enough.
So, as you can see, there are significant barriers for many of us when it comes to accessing mental health services. It is true that the government is investing record amounts of funding into the mental health system, but it is also true that there are record levels of demand that we haven't yet been able to cater for. Thank you so much for listening to this episode of Young, Dumb and Informed. If you liked this episode, share it with your friends or share it to your Instagram stories so that your friends can be informed too. It will be a really big help to supporting a small independent media company. We'll see you next week.